Hello, good afternoon. My name is Jara Fortaleza and I'll be the student nurse today. And today I will be collecting some subjective or objective data and assessing the level of consciousness for the patient. Um, and first thing I want to do is I want to prepare the client and let them know that I will be asking them some questions, some just basic questions. That way I could determine if they're, the level of their consciousness and what their mental status is. So first, I would also want to gather all my equipment in the room. I would have my pencil, my paper, and then my Glasgow coma scale, my depression questionnaire, my sad person suicide risk assessment form, my St. Louis University mental status assessment, my confusion assessment method, the CAGE questionnaire, and the alcohol use disorder identification test or the audit test. So these are all the forms used to assess the mental health status of the patient. First, when let's just say we have an older adult patient, we want to check first the vision and the hearing of the patient. That way we know if there's any existing or if there's anything existing for the patient before we assume any mental problem from them. And then second, so I would like to observe my patient's level of consciousness. So with this one, I would probably call their name, ask their name. Hi, Miss Vina. Miss Vina.
Yes.
Okay. So when the patient answers, it means they have a normal finding because they are alert and they are oriented with what's going on in the room. And if they're asked any question or if they're in an interview, they could answer it correctly. But if the client has an abnormal findings, it means that they're not alert or they don't know where they are, or if you ask them the day or the time, they cannot determine those kind of questions, so they cannot respond appropriately. So you would like to check them, their name, their address, and their phone number. That way you could fully assess them if they have normal findings or abnormal findings. Let's just say the patient is not responding accordingly. So you would like to give them a little shake. So that way you could probably awaken the patient and see if their level of consciousness is good. So, Miss Vina?
Yes.
Okay. So for this patient, she is alert and she was able to, respond to my question. Even if I shake her, she was able to respond it accordingly. But let's just say a client that is not responding or is in bed and they just don't have any response for any questions that you have. You would also like to check their pain stimulus if they're having any pain, or if you tap on their skin or touch them, if they're having any response to it. So if there's an older adult, or that you have a patient, a client that's an older adult, sometimes the information that you're asking from them takes a little bit while because of their slow response. But usually they're sometimes they're also alert when you're asking those questions. Sometimes when the patient is when the patient's hands are on the chest, it also can give you some abnormal findings, like there is a corticospinal tract lesion that's making this patient do this position. So just take note of that one. And also if there's any lesion on the diencephalon, the midbrain, and the pons, usually the patient's position is going to be extended and then quite stiff, and their extremities are internally rotated to their body. So if you see the patient is quite stiff and their hands are extended and fully rotated, internally rotated, it means somehow maybe they have some diencephalon lesions, some midbrain problems, or prawns problems. Okay, so for my next one, if the patient is not responding, let's just say, even if you've already done all this assessment, you ask them their name and then they're not responding, you shake them and you inflicted a little bit of pain and they're not responding, you want to use the Glasgow coma scale. That way you could assess this patient. So so it means that those who are high risk of rapid deterioration of the nervous system, you want to use the Glasgow coma scale. So it is score from, like, the lowest score is 3, which is that's the least score that you could get, and the 14 is the perfect score. So if you have a Glasgow score of 14, it means you have an optimal lesion, optimal level of consciousness. But if your Glasgow coma score is less than 14, it means there are some impairment in the level of consciousness. A score of 3 is the least that you can get from this one. So from the Glasgow score, it's determining the verbal response, and then the motor response, and the activity of the patient. So it has a corresponding score to it. So if, say, your patient is intubated and or they have a phastic, or they are a phasic patient, you cannot do the Glasgow's coma scale Glasgow coma scale, because of that impairment. So although like this Glasgow coma scale is still widely used in the ICU. So next, I would like to observe the posture, the gait, and the body movement of my patient. So if the client appears to be relaxed and the shoulders are at the back and erected when standing or sitting, and the gait is rhythmic and coordinated with arms swinging at the sides, it means you have a normal finding for their posture, gait, and the body movement. But if you see that your patient has a slumped posture, it may reflect any feeling of powerlessness, hopelessness, a characteristic of depression or organic brain lesions or diseases. Sometimes when the patient has schizophrenia, they would have some bizarre body movements, and also behaviors, maybe also a side effect of drug therapy or any other activity. And if they are tense or anxious, clients, they can elevate their shoulders towards their ears and hold their entire body stiff. So you would like to observe those data. That way you would know if it's an abnormal finding. So usually those observation will be abnormal findings. And in older adults, the purposeless movements, wandering, aggressiveness, or withdrawal may indicate neurological effects. So I would then observe the behavior and affect. So for this method, if the client is cooperative, purposeful, and is interacting with others, the effect is appropriate for the client situation. Sometimes you have mild or moderate anxiety. It can also be seen with clients that's apprehensive about having the health assessment performed. But that's still a normal finding if you can just see the patient is a little bit anxious. But if you find that your patient is uncooperative, they have bizarre behavior, and are angry or they are mentally ill, violent. That is some one of the abnormal findings. And also, if say your patient is anxious, they are fidgety and restless, and also some degree of anxiety will be seen in ill patients. Apathy or crying may be seen with depression as well, so you want to take note of that. And incongruent behavior may be seen in clients who are in denial of problems or illnesses. Prolonged euphoric laughing is a type of mania. And then next, you would like to observe their dressing and their grooming. So with this examination, you would like to check if the dress is appropriate and according to the occasion. Of course, it also depends on the culture of the client. Sometimes that also affects the how they dress and the grooming, and also the developmental level of the patient, the age, the socioeconomic level, and the subculture are also affecting the appropriateness or the preference of the patient. So you would like to take note of that one and check their records if they have any cultural um, you know um, background that alleviates this normal data. And then if you have a patient that's unusually meticulous in grooming, like they have these mannerisms, sometimes because they have this obsessive compulsive disorder, poor hygiene and inappropriate dressing. Sometimes it's because they have some brain syndrome going on, or sometimes they're just, depending on how they dress. Um, it's also effect of, if they have schizophrenia, because sometimes they have manic disorders, they dress bizarrely. So you would like to take note of those abnormal findings. And then you just want to, uh, be careful, so you don't need to be presumptive of the patient, because sometimes the patient are dressed, just the way they prefer, just because that's what's trending, or you know that's just because that's how they dress up. It doesn't mean that they have abnormal findings or something like that. Of course, overall of this assessment is going to determine if it's an abnormal finding. So um, let's just say your patient also is wearing an extremely light clothing, and then or an extremely warm clothing. It also can give you a cue if they are ill, they are grieving, they are depressed, or if they cannot tolerate some cold or heat. All right. And also if let's just say the patient has extremely loose clothing, you would also want to see if they've lost some weight. That way, you would compare your data from the last time you've seen them, or if you can ask the question if they lost some weight. And also if, let's say, the client is also like wearing a long sleeve when it is a really warm weather, sometimes it is also an indication that probably they're doing drugs. They have like some, needle marks that they're just covering. So you would find those abnormal findings with the patient. So you want to document those data. And then next, you want to observe hygiene. So the base assessment on the normal level of hygiene for the client's development and socio-economic level and cultural background. So usually, if the client has normal findings, they are well groomed, and they are properly dressed for the occasion. So you would also check on how they are overall dressed up, and if there's any like stains in their fingers or nails, it doesn't mean that it's an abnormal finding. Sometimes it's because they are a mechanic, which they have a lot of oil in their finger, and also if they have like their dirty hands. Maybe they are a gardener. So it depends on how the the patient presents, and you can also ask them if what their job is. That way you could confirm those data if you see any stains in the hands. However, if you see an abnormal findings, you will see a dirty, unshaved, unkept appearance from the patient, sometimes some foul body odors. It means they've probably neglected themselves, or they're in like a depression, or they indicate some self-care deficit. Poor hygiene may reflect neglect from the caregiver as well, so you would like to note those findings as well. Some breath odors from smoking and from drinking alcoholic beverages, you would like to also take note of that one. um, that way you can assess this patient accordingly. So sometimes there's some cultural considerations as well. You would like to see what's the race of the patient, because sometimes Asians and Native Americans, they have fewer sweat glands. So somehow, you know, more likely the Caucasians and the Black Africans have more sweat glands in their body. So they have some odor going on. You just want to check on that cultural consideration. Next is the facial expression. So you would like to also check on the eye contact of the patient and the affect level. So if the client maintains an eye contact with you, he smiles, or she smiles and frowns appropriately, it means you have a normal finding. But if the patient or the client has a reduced eye contact, sometimes it can also tell some form of depression, or something going on with their mental status. So sometimes if you have some extreme facial expressions of anger, happiness, or if you're frightful, these are some symptoms if you see an anxious client. So those are some abnormal findings as well. But if you have a Parkinson's disease, there usually they don't have much expression. They're mask-like appearance. They are staring. Staring watchfulness appears in metabolic disorders and anxiety, and inappropriate expressions, like they're just smiling without any reason, even if or they're expressing some sad thoughts. So you want to assess this patient if they're you're observing those kind of findings. And then let's just say your patient has Bell's palsy, or was a stroke patient. Sometimes they have some deformities on their facial structures. Their one of the side is droopy or something like that. So those are also one abnormal findings that you will see from the patient. And then you want to observe their speech. You want to listen their clarity of their tone, the pace of speech, and um, how they talk to you. So speech is, if it's a moderate tone, it's clear, concise, and it's appropriate culturally, it means you have normal findings. But if you find the patient that's just, talking slow, repetitive, speech is somehow a characteristic of depression or Parkinson's disease. Loud, rapid speech may occur in manic phases. So people that are bipolar, they are quite loud, disorganized in their speech, and they have long periods of silence that indicates mental illnesses. So you would like to check on this neurological disorders, and see if they are corresponding to your data. And then if, let's just say, your patient is having some difficulty in speech, you can also ask them to name the objects in the room, or you can do some additional testing for the patients. So if the client are familiar with the objects in the room without any difficulty in reading or in writing, it means they are coherent in the sentences, and they are in normal cognitive behavior. But if the client cannot name any objects correctly, they cannot read properly, or they cannot write even a basic sentence, it means there's some abnormalities shown in their behaviors. So you would like to take note of that one as well. And then next, you would like to observe their moods, their feelings, and expressions. You would like to ask the patients, how are they feeling today? And what are your plans for the future? So for this one, if they answered you appropriately and they cooperate, and they express feelings of and verbalizes positive responses, that means you have a normal finding. But if they are flat affect or euphoric, they have anxiety or fear, irritability, depression, and some examples of altered mood expressions, you want to take note of that one, because sometimes depression, the anxiety, and these are common from the patient that has a mental disorder. So you would like to take note of that one as well. And also if they have a feeling of grandiosity, high level of energy, and engagement in high risk but pleasurable activities is also seen in manic phases. And excessive worry may be seen with anxiety and obsessive compulsive disorders. So everything here, you would like to take note of that one. um, so you would like to also use the depressives, the you would like to do some scoring for this patient if they have any depression as well. So next, would like to observe the thought process and perceptions of the patient. So you would like to check on the clarity, content, and perception by acquiring about clients' thoughts and perceptions expressed. Like you want to ask them, tell me more about you, what you just said, or tell me what your understanding of the current situation is. If the patient expresses full, free-flowing thoughts, and they could follow the directions appropriately, it means you have a normal finding for that patient. But if the patient responds with persistent repetitions of idea, illogical thoughts, interruptions, you would see this sometimes in a schizophrenic patient. They have rapid flight of ideas, repetition of ideas, they use rhymes, and then sometimes they're just like irrational, they're bizarre, responding to this question. So those are some of the abnormal findings as well. um, and also, like, if you have a patient that is suicidal, you would also like to check or assess their perceptions. If you ask, how do you feel about the future, or have you ever had thoughts of hurting yourself, or doing something with yourself, or how do others feel about you? So if the patient's verbalizing positive thoughts and healthy thoughts for the future and self, it means you have a normal finding. But if your client is sharing some suicidal attempts from the past, it means, of course, you have a suicidal patient. You want to document that. And sometimes they joke about death, and they're just, like, talking about death all the time, or they don't feel worthy about living. So those are the signs that your patient is suicidal. So you want to give them some more assessment from that finding. And so for this one, you want to use the sad person's assessment technique. That way you would go and do an in-depth assessment for a client who has a suicidal tendency. And then next, I would like to assess the orientation of the patient. And so for this one, you would like to check with the clients if they have what's their name, their family, the names of their family members and what's the hour of the day, things like that. So if they're aware of their self and the others and the time and the home address, it means they have normal findings. However, if you find a reduced degree of orientation that can see with psychiatric illnesses such as withdrawal from chronic alcohol use or schizophrenia, those are the abnormal findings you'll find for the patient. Sometimes they are hallucinated, and their sensory perceptions occurs without external stimuli. So they are disoriented. You would like to take note of those things. So sometimes when you're assessing the orientation of the time and place of the person, usually the time is usually lost first, and then the orientation to the person is usually lost last. All right, so just take note to that one. And then you want to assess the concentration. Note that the client's ability to focus and stay attentive to you during the examination. So you would like to also instruct them to say pick up the pencil or the pen. That way they know how concentrated this patient is, their level of concentration, if you want them to pick it up from the left hand to the right hand, something like that. So you would like to listen to the patient and if they follow the directions without any difficulties. If they are distracted or inability to focus, it means they probably have some anxiety or fatigue or attention disorders, or impaired state because they are under the influence of alcohol or drug intoxication. So you would like to take note of those events, and then you want to assess the recent memory. You want to ask the patient, what did they eat today? All right, and what is the weather like today? So recalls recent event without difficulty is one of the normal findings. And if your patient is not able to recall the recent events, it means it's an abnormal findings, and you want to take note of that one. So sometimes that's also a cue of a dementia patient. So you would like to do the slums technique, the slums assessment, if you have this kind of a patient that's having some difficulty recalling some recent events. All right, and then you would also want to assess the use of memory to learn new information. So if you say you ask the client to repeat four unrelated words, and then they were able to repeat it correctly without any period of if they're not having any difficulties in remembering, then it means you have a normal patient, normal finding from the patient. But if they cannot recall any words that you have asked them, it means sometimes there's some anxiety related to it, or also Alzheimer's. Maybe there's an early signs of Alzheimer's from that patient. Um, that's all for my demonstration today. Through those findings, I will be able to assess the mental health status of my patient. Thank you.